Okay, so this is the video demonstration for venipuncture. This is not a skill that you're going to check off in lab, but normally we would show you how to do that, and so we have this video for you to watch. So first you're going to need to gather your supplies. Obviously you need your order from the provider. That order is going to tell you what labs to draw. So that could be something like a BMP or a CBC. And from there, it is your responsibility as a nurse to gather the right vacutainers that correlate with that lab. That's not something that you have to memorize as a nurse. For example, red could be for your CBC, purple could be for your BMP, so on and so forth. There's always cheat sheets around any unit you work on. And typically lab would do this anyway, but if you were in a setting where you had to do this, this is something that you could find information on. So you need the correct vacutainers that correlate with your order. You would also need the tools to draw. So you would need a barrel with a needle. This device has two ends. One side is the needle, and one side is the device that punctures the vacutainer. So to set this up, you simply twist this off. There is a needle inside of this coated gray tube, and it simply twists in. So this is where you would access the vacutainer. And the other side has a needle. Sometimes they have safety, sometimes not, but this is the safety device. And then you'd pull straight off for the needle. Again, remember, you never recap, we're just showing you so you know what it looks like. So you'd have that ready to go. You have your vacutainer is ready to go, and you'd have alcohol wipes, a piece of gauze, and tape. Typically, you would draw labs using the antecubital fossa. So we would go in the antecubital space here. Remember from lecture that you are feeling for a vein. You are not going off of sight. So I'm feeling for a vein that is full and bouncy. So first, obviously, I would check my order, gather my supplies, wash my hands, introduce myself to the patient, let them know what I'm doing, and first I want to find a good vein. So in order to do that, we apply the tourniquet, and you'll have time to practice putting on a tourniquet on each other and the mannequins in lab. So I'm putting on a tourniquet. I want it to be tight enough so the vein can be dilated, but not too tight that I lose their radial pulse. I want the tourniquet tails to be up so it doesn't fall in my sterile field. And I want the tourniquet to be 2 to 6 inches, depending on if you're looking in the book or ATI, above the site that I'm accessing. So I'm going to put on the tourniquet, and I'm going to begin to feel for a vein, and I feel one here that is full and bouncy. If I have all my supplies set up and ready to go, I can leave this tourniquet on and go ahead and prepare my sterile field. If not, I would want to take my tourniquet off, so I give their arm a break. In this case, I notice that I don't have gloves, so I'm going to take my tourniquet off, because once I make a sterile field, I don't want to turn my back on it. So I'm going to grab some gloves. All right, Mr. Jones, we're going to go ahead, get you ready to go. I see this is a good vein here. I'm going alcohol off the area. And anytime we're accessing a vein, we want to scrub in both directions for 30 seconds. And that's because we're accessing their systemic vasculature, and we don't want an infection. While that's drying, I'm going to put on my gloves, just like you learned in Junior 1 with injections. Make sure that's dry, and I'm ready to go. These vacutainers have an order as well that they need to be drawn in. That's also on your cheat sheet. So I know from my order and my cheat sheet that I'm going to draw purple, red, and then gray. So here I'm going to take off the cover. I'm always going bevel up so I can turn my safety out of the way if I need to. This kind, the safety just goes over the top. I'm coming to the side of the vein and I'm pulling the skin taut either to the side or down. This Vacutainer I'm holding like this, so when I access the vein, I move with the patient. If you go like this, you have a lot less control. And I'm also going to take my first Vacutainer and I'm just going to set it in here, but not activate it, so that when I'm in the vein, I'm going to be ready to go. So you're going to feel a big poke. Now, when you do an IV start, or if you use a butterfly device that looks like this, you would typically see a flash in this barrel. On these devices, we don't have that, so you kind of just feel for a pop into the vein. So I felt a pop. I'm going to hold this hand stable. I'm going to use these flanges to push the Vacutainer in. Now on the mannequin here, we don't have blood in them, so it just looks clear. But notice I'm using these flanges here because otherwise if I just pushed in, I'm going to be pushing deeper into the patient and we don't want to do that. I activate this until it stops filling, which is usually around 3/4 full, but they are suctioned to fill how much they need. I'm going to take this one off. I'm going to agitate it a few times, grab my next one, do the same thing, go until it's done filling, agitate, and my final one, go until it's done filling. Now we need to remember to remove the tourniquet, so I like to pull the tourniquet when this is almost done filling. Pull that off, agitate, grab my gauze. I'm just going to lay it on there. I'm not going to push, otherwise I'm going to push the needle deeper into their skin. Set it on there, pull out, hold pressure, needle safety into the sharps, and I'm going to hold pressure. Anytime you remove a vein or an IV or anything from the vein, you want to hold pressure for at least 2 minutes so that the vein fully clots off. If you just hold it until the blood stops flowing or bleeding, you're only allowing the skin to clot, not the vein to fully clot off. And that's why we send patients home with bruises, and we don't want to do that. So we'd hold this for 2 minutes. The patient can hold it. And then we'd have a piece of tape ready. I could take off my gloves at this point if I wanted to. Wash my hands. And then I would make sure that these tubes are labeled, and I would place them in a biohazard bag inside the room. They're usually labeled with patient's name, date of birth, and time, date, and initials of draw. Many computer systems will just have labels that get printed off and you can put them on there, but make sure you label and place them in the bag inside the patient's room to make sure you have the right patient, and then those will get sent down to lab. And then we would document obviously our date, time, initials, number of attempts, what labs we drew with number of Vacutainers, how the patient tolerated it, and the site of the draw as well. So that is demonstration of venipuncture.